Male genitourinary disorders. Genitourinary disorders are illnesses that occur when the urinary organs and genital organs are not functioning properly. These disorders may be the result of aging, illness, or injury. The organs involved in urination including 2 kidneys, 2 ureters, the bladder, 2 sphincter muscles, and the urethra. So let's take a look at the urinary tract system and see how it works.
The term urinary tract includes all the organs that are involved in making urine and flushing it out of your body. Urine is made in the kidneys, those 2 bean-shaped organs next to your lower back. They extract waste products from your blood and send them down a tube called the ureter. This tube leads into the bladder, which collects the urine. When it fills up, you get the sensation of having to go to the bathroom. You voluntarily open the sphincter muscles in a tube leading out of the bladder called the urethra. This allows the urine to flow out of your body when you urinate.
Beginning at about age 30, a man's serum total testosterone level declines by 1 to 2% per year. Men aged 70 to 80 tend to have serum testosterone levels that are about 1/2 to 2/3 of those of men in their 20s. Special considerations related to the male geriatric population include prostatitis or inflammation of the prostate gland, benign prostatic hyperplasia, which is the most common benign tumor in men, urogenital cancer, interstitial cystitis, and neurogenic bladder. Neurogenic bladder being when pelvic nerves do not function properly. This can either lead to overactive or underactive bladder. We can also have kidney stones, and that usually develop when the urine becomes too concentrated. Urinary incontinence describes the inability to control the bladder. The bladder spontaneously empties all or some of the urine. Aging is also associated with the urinary incontinence symptom because the bladder muscles become weaker over time. Urinary tract infections and the effect on the reproductive organs including the testicles, epididymis, the prostate gland, and penis. It is estimated that more than half of men aged 40 to 70 in the United States are unable to attain or maintain a penile erection sufficient for satisfactory sexual performance. Sexual difficulties in men include premature ejaculation, which is best defined as persistent or recurrent ejaculation with minimal stimulation before, on, or shortly after penetration, and before the sexual partner wishes. Premature ejaculation is thought to be the most common form of male sexual dysfunction, with an estimated prevalence of up to 40%. Erectile dysfunction can be defined as the inability to achieve and maintain penile erection sufficient to perform satisfactory sexual activity. Between 20 to 30 million men in the United States have some form of erectile dysfunction. The disorder is also present in approximately 30% of men aged 40 to 70. You may also see the symptom of loss of sexual desire or loss of libido. Common causes of erectile dysfunction include alcohol abuse, anxiety, coronary artery disease, diabetes, hypertension, liver failure, medications, peripheral vascular disease, renal failure, smoking, surgery, and trauma or injury. As one ages, this will affect the function of your genitourinary organs. For example, the kidneys, the filtering system slows down. The bladder, the elasticity of the wall changes, it becomes less stretchy. The testicular mass decreases. Testosterone level also decreases, and the prostate gland may be enlarged. Treatment of genitourinary disorders depends on the specific type and severity of the disorder. If left untreated, some disorders may cause infertility. Therefore, patients with symptoms should seek medical attention as soon as possible. Common drug treatments include analgesics or pain medications, Viagra, penile injections, surgeries, or prosthesis, at-home or IV therapy in the doctor's office, hypertension medication, antibiotics, and antimuscarinic drugs. Depending on the disorder and severity, monitoring of treatment can vary depending on disposition from home care to hospitalization. Education is vital to ensure understanding of one's own natural body system changes. Some medications can affect cognition, and so must be used with caution and with monitoring of mental status. Advances in medication therapy and education on understanding male sexual dysfunction have resulted in a greater number of patients seeking care for genitourinary disorders. Learn signs and symptoms to look for, such as prostate enlargement, fever, painful urination, dark urine, blood in the urine, urinary frequency. Ensure getting treated for health disorders as well, such as high blood pressure and diabetes, that may prevent problems with urinary and sexual dysfunction. Thank you.